So good morning. I'd like to welcome everyone to this webinar on behalf of the National Academies of Sciences, Engineering, and Medicine. I'm Dr. Linda McCauley. My colleague, Dr. Bob Phillips, and I are co-chairs of this ad hoc committee on implementing high-quality primary care. I wish to recognize our fellow committee members who are volunteering for this study. This is a list of all our committee members, most of whom are on the call today. You can see that they represent a number of organizations throughout the United States. And as we get into the webinar and have questions and answers, you will have an opportunity to meet many of these members who are giving their time to the committee for this important work. I'd also like to acknowledge the study staff, Mark Meisner, who is serving as the study director, Cheryl Nass, who is director of the Board of Healthcare Services, Tracy Lustig, Sarah Robinson, Samira Abbas, Sydney Trang, as well as the American Academy of Medicine Fellows who are with us, Cameron Matthews, Dema Cato, and Lars Peterson. We'd also like to take a moment to thank our study sponsors, whose generous support has made this important work possible. And I think you can see from the scope of the sponsors the wide base of support and interest in this work. Today, we've invited representatives from several patient groups representing various perspectives on primary care. We've asked these groups to share with us what primary care means to them, what they like about it now, and how, in their view, it can be made better in the future. Hearing from these groups today will greatly inform the committee's broader task to examine the current state of primary care in the United States and develop an implementation plan to build upon the recommendations of the 1996 IOM report, which was entitled Primary Care, America's Health in a New Era. The comments today will help us strengthen primary care services in the United States, especially for underserved populations, and to inform primary care systems around the world. More information on this study can be found in the project website. I think we have a slide. I don't see the slide of the web. We'll get that to you. It's the nationalacademies.org/primary care. We can find out more about the charge of this committee. I'd also like to give listeners a sense of the format of today's meeting. We're going to have short presentations from our invited speakers who will share a variety of patient perspectives on primary care, followed by question and answers from the committee members. Those of you in the public who are joining us on this webinar can submit comments via email to primarycare@nas.edu. Now I'll turn the meeting over to my co-chair, Bob, to discuss some reminders for today's meeting.
Linda, thank you so much. I want to note that this is an open, on-the-record information gathering session. That is, that the committee is in the process of assembling materials for the study and that it will examine and discuss as it develops its findings, conclusions, and recommendations. And I want to reiterate, we really do want comments from the public, so please send us your thoughts and your concerns and share your recommendations with us. I want to ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the National Academies. In addition, committee members may ask probing questions that may not be indicative of their personal views. The committee deliberates thoroughly throughout the draft report writing process. And moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee. The committee then must respond to this review with appropriate revisions that adequately satisfy the National Academies Report Review Committee and the National Academy of Science president before it is considered an official National Academies report. The committee's report is expected to be issued in early 2021. The committee is seeking direct input from patients about their experiences with primary care, and we encourage you to share the link on the screen to help us solicit those responses. Now I'd like to turn over